Hi, and welcome to this session of Collegial Conversations. In today's session, we're going to be talking about internalizing behaviors in the classroom. The work that we're doing with PFS CARE is supported by a grant through IES, through which Dr. Sarah Lindstrom Johnson is the principal investigator. So my name is Marianne Vilhauer, and I'm a school psychologist and also a member of the PFS CARE team. And so I'm happy to be here today to talk with you about internalizing behaviors, an often overlooked part of problem behaviors that we see with students in schools. So this afternoon, what we'll be talking about are defining what are externalizing behaviors, what are some of the characteristics of those, how they manifest themselves in the classroom. We're going to look at a few statistics on the prevalence of internalizing behaviors and internalizing behavior disorders. And then we're going to talk about strategies to support students who exhibit externalizing behaviors at school. So we're going to talk about school-wide systems that can support these students, as well as some specific classroom strategies that will help to support students with internalizing behaviors in the classroom. So the first thing that we're going to spend a little bit of time in is talking about internalizing behaviors and taking a look at what are they, what are some of the characteristics of those, how they differ from externalizing behaviors, and how they manifest themselves in the classroom. So just as a reminder, all behaviors are a form of communication. And most often, in schools, the more typical type of behavior that we talk about, or kids who exhibit these types of behaviors get referred, are those that exhibit externalizing behaviors. So externalizing behaviors are highly interactive. They're social behaviors, meaning not necessarily that they occur peer-to-peer, although they may, but social from the perspective of that we can see them. Whereas internalizing behaviors are notable for what they're not. Often students who engage in problematic internalizing behaviors are socially or academically just treading water. They're disappearing while others in the class move forward. And interestingly enough, or maybe not, research shows that teachers and educators tend to under-refer students who exhibit internalizing behaviors. One of the reasons for this is that they're not disruptive, and sometimes they go unnoticed. And so the students who are engaging in the externalizing behaviors, the physical aggression, the shouting, the very direct non-compliance, that sort of things, those kinds of behaviors are what tend to get our attention, especially in the education system. So some examples of externalizing versus internalizing behaviors. So again, externalizing behaviors are those that we can actively see. They include verbal or physical non-compliance, arguing, being out of your seat, being out of the classroom, engaging in other kinds of inappropriate physical acts, hyperactivity, impulsivity, aggression, either verbal or physical in nature. And on the other hand, internalizing behaviors are those that we sometimes don't see because they're directed inward. The child or the individual directs these behaviors inward. So things like anxiety, depression, withdrawal. We might see a child who's overly shy, who might have some peer difficulties, doesn't have a lot of friends, who might have specific phobias or fears, perfectionism, and something called cognitive rigidity, meaning that they're not able to switch their thinking to the demands of the situation. They get stuck on their thoughts. So you can see, because those acting out or those externalizing behaviors are the ones that often catch our attention versus those that are internalizing for students. So I mentioned before that internalizing behaviors, or kids who exhibit internalizing behaviors, often go unnoticed, and that these students are under-referred for any additional supports or services. So one study in 2008 showed that students who exhibited externalizing behaviors, about 85% of them received mental health services, as opposed to students who exhibited internalizing behaviors at around 65%. And then when we look specifically at the education system, you can see that students with externalizing behaviors in this study were referred for and qualified for special education services at a rate almost double of those with internalizing problems. So these are kids who actually had externalizing behavior problems or internalizing behavior problems. And those that had that acting out or that very disruptive behavior that we could see were the ones who were referred for assessment and received special education services. So whenever we're talking about behaviors in general, externalizing or internalizing, these are some of the things that we have to make sure that we consider. One of them is child development. So we need to have an understanding of what typical development is, because certainly there's times in a child's development where externalizing behaviors and or internalizing behaviors may be developmentally appropriate. So when we're talking about toddlers who might tantrum, that would be a tantrum behavior would be typical for a child that age. If we're having a 12-year-old who's tantruming, then that is not typical of normal development at that age. So that's something that we have to take notice of, is where is the child in their development, and is the behavior normal, or is it not typical of that age or period of development. The other thing that we have to make sure that we keep in mind is culture, because behavior by and large can be culturally dependent, meaning what is appropriate in one culture for a behavior may not be appropriate in another culture for the behavior. So for example, if we're thinking about eye contact, if we don't take culture into consideration, we might determine that, we might think that a child with poor eye contact could be a little bit socially withdrawn or socially awkward. However, there are some cultures where direct eye contact is considered rude, and it's not considered a typical behavior. So we definitely want to make sure that we're taking into account a student and or family's culture when we are thinking about behavior. We also want to take a look at the activity level, or thinking about like the frequency, the intensity with which the behavior is occurring. If it seems to be a problem behavior that is occurring rarely, it might not be indicative of a specific problem. It might be a situational or context sort of issue. We want to take into account both the child's self-view, and this is important when we're talking about internalizing behaviors, as we'll talk about a little bit more in a bit. But we also want to take a look at others' views of the behavior. And so is the child having low self-esteem? Do they think that they're not competent to perform the behavior? And is the behavior or behaviors existing to the point that others are questioning it, and that's having an impact on the child? Another thing to consider is the child's emotional response. And so are they responding in what we would consider a typical manner? So did whatever caused the behavior produce a typical reaction, or is the emotional response way out of kilter for what the context was? So, for example, a student who maybe gets a B on an assignment, B or A minus or something on an assignment, and do they completely melt down over that kind of a grade, even though it's an above average grade? That might be an atypical response given the circumstance. Whenever we're talking about behaviors, externalizing and internalizing, we also have to consider the possibility of trauma. Students who've been exposed to trauma might engage in externalizing behaviors, they might engage in internalizing behavior, or they might engage in a combination of both. And so we want to kind of think about what might be causing the behaviors, and is there a possibility of trauma? Finally, another consideration we want to think about is the impact on functioning. And so whenever behaviors get in the way of typical functioning, we would consider that problematic and probably at a point where some sort of intervention and or support need to be put in place for the child. Obviously, the impact on functioning is definitely related to the age of development. As I mentioned before, that a child who tantrums, even though as a toddler it might be appropriate, if they're doing it to such a degree that they're not able to engage in typical activities, that would be having a significant impact on their functioning. And so we would definitely want to consider intervening. So one thing to keep in mind is that behaviors can be a hot button item for both educators and for parents. And so just, as a reminder, parents have their perspective on behaviors, the school has their perspective on behaviors, and of course the child who's engaging in the behaviors is part of all of this as well. And so we are best able to help children when we work together, when schools and families work together to provide consistent support and feedback to kiddos on their behavior. And so, trying to stay out of the blame game and establish those positive relationships with parents, hopefully before there are any behavior concerns, so that we can work together to help support children with their behaviors. So that's kind of just an overview. We're going to talk a little bit more specifically about how these behaviors might look in the classroom. So whereas externalizing behaviors are often referred to as out of control, internalizing behaviors are referred to as over-controlled. So a child or adolescent who's engaging in internalizing behaviors typically tries to have high control over the way that they are showing different emotions and feelings. I've already mentioned that they can be invisible because they generally aren't disruptive to others. We might notice things. For example, an anxious child might be picking at their fingers excessively or that sort of thing. But for the most part, that wouldn't be disruptive to the classroom setting. But because they're less disruptive, they often go unnoticed and they often are not intervened upon, which can be really damaging, because when we don't provide support with students who are having difficulty with internalizing behaviors, the students can grow in their level of distress, and these behaviors can become actual disorders that are based around internalizing behaviors, or the behaviors can switch and become externalizing behaviors. What we know about students who exhibit internalizing behaviors is that they're more likely to be rejected not only by their peers, but also by adults. One of the good news, if you will, or good pieces of information with internalizing behaviors is that the outcomes for students who exhibit internalizing behaviors, provided that they receive the support and strategies that they need, there's better long-term outcomes for these kiddos than ones that exhibit only externalizing behaviors. So that's another reason why we want to intervene and help support these kiddos, is that we don't want those behaviors to switch and become externalizing behaviors. So some of the characteristics of internalizing behaviors. A student can be very nervous, have nervous tendencies, seem like they are just not at rest or at peace with themselves. They can be significantly withdrawn. They can be withdrawn from peers. They can be withdrawn from adults. They may eat more. They may eat less. That could be kind of a noticeable change in the behavior. They can be afraid, irrational fears, irrational phobias, that anxiety. They may appear lonely. They may be sad. They also can have difficulty with executive functioning things like difficulty concentrating. And they also can engage in negative self-talk. Here's some more possible indicators of a student who might be having internalizing problems. You might see excessive crying, again, that is not part of an appropriate developmental period. Pouting, chronic absenteeism. They might be sleepy, lethargic. That's especially true when kids might have depression. They might be teased, they might be bullied. If they're not teased or bullied, they might just not be socially connected. They might be the kids that are out on the playground by themselves, or sitting in the lunchroom with nobody to eat with, or when kids are given the opportunity to choose partners or groups for group work in class, they're never chosen. Students who have internalizing behavior problems may be self-injurious. And so they may engage in things like cutting or in headbanging. What we know is that students who engage in cutting often describe it as the internal pain, the emotional pain is so deep that they have to cut themselves to release it through physical pain. And so typically kids who are engaging in that self-injurious behavior have reached the point where the emotional or psychological pain is so great, they manifest it with a physical pain that matches the emotional pain. Could be something as simple as they never stand up for themselves. They're the pushover in class. If kids are having free choice time, they're the kids who, somebody else is coming over and sweeping in and taking the activity that they chose to work on, or coming in and just controlling the activity, and they just can't stand up for themselves. They might just be quiet, or they might just walk away from the situation. When we see kids who are extremely shy or timid, and again, there's some developmental perspective with this, but it's kids who might actually, to an extreme, have school anxiety, where they just can't even get to school, or again, on an extreme, a student who has selective mutism. And then, it could be something that's a little bit more or a little less noticeable, just like they constantly need that reassurance, that they don't have the confidence in themselves, And so they're constantly looking for that reassurance, that support, that knowledge that they've done a good job. And again, looking at this in the whole kind of continuum of normative behavior. And these are kids that stand out with that. So oftentimes, internalizing behaviors, especially when they're associated with things like depression and anxiety, cause a distorted thinking cycle in kiddos. And so, there might be they might exhibit some problems that are based on some feelings that they have, and then the feelings trigger thoughts, and the thoughts are distorted, which then just perpetuates this cycle of internalizing problems or behaviors. So oftentimes kids with internalizing problems they have distorted facts. They can participate in the exact same interaction or situation and come away with thoughts and feelings about it that are completely different than what anybody else did in that, or felt or thought in that interaction. So it's not a purposeful thing. It's not like they're being purposely manipulative about it. It's just, it's a cognitive pattern that happens with these kinds of problems, and certainly with the disorders, the mental illness disorders that represent internalizing problems. So these individuals tend to have very, very negative views of themselves, and this gets very ingrained in their thinking. They become hopeless. They ruminate or perseverate on things, and often on these distortions. And they are fatalistic in their thinking. Nothing will ever go right. They will never master this. They'll never finish this. They'll never make friends. Never, never, never. So kind of that Eeyore, glass half empty sort of perspective. And because of this distorted thinking style, they have very poor problem solving skills because they get stuck in this cognitive loop of distorted thinking. So here's some of the potential impacts of untreated or unsupported internalizing problems. There can be significant academic issues. I mentioned before, these are the kids that just fly under the radar. And sometimes when kids are in early elementary school, they're still able to kind of keep up with the academics. But as the rigor of academics pick up, their internalizing problems start to affect their academic performance. Similarly, they tend to have poor social relationships. Again, as kids get older and social demands increase, that's often where we see maybe where we identify that these problems need some intervention, is because these kids are so isolated and so socially disconnected, especially going into middle and high school years where social relationships become so important. Kids have that diminished self-esteem. So really, which is very interesting because they, one of the things that can also, another manifestation of this is perfectionism. And so in the example I gave before about a student who gets a B minus or I'm sorry, an A minus or a B, if they have those perfectionistic tendencies, that isn't good enough. And so that just contributes to that low self-esteem and see, I'm no good. I can't even get an A on this. Untreated internalizing problems can lead to later mental health problems. So even if the internalizing problems are not so significant that a child would be diagnosed with internalizing problem disorder, it could lead to later diagnosis or chronic mental health problems. So if a child would be diagnosed with depression or anxiety as a youngster and it isn't treated or supported, that becomes a chronic mental health it can become a chronic mental health issue. It can lead to substance use. So we know, especially with adolescents who are depressed or anxious, they often will self-medicate with substances. So there's a high comorbidity. Those tend to go together. Also suicidal ideation. So thinking about suicide, which goes along with that fatalistic sort of characteristic and the low self-esteem, and not a good support network because they're socially isolated. So it can lead to thoughts of suicide, attempts of suicide, and unfortunately, completion of suicide. So the implications of untreated or unsupported internalizing problems can be really significant. Here's just some statistics from the CDC for prevalence rates of kids aged 3 to 17. This is pre-pandemic, so this is from the period of 2016 to 2019. So you can see almost 10% of kids in this age group had anxiety, about 4.5% had depression. There again was this comorbidity, so disorders that go along together. So 3 out of 4 children who had depression also had anxiety. 1 out of 2 that had depression had behavior problems. 1 in 3 children who had anxiety also had depression and behavior problems. 1 in 3 children with behavior problems had anxiety. So you can see if we're not making these connections in school, when we see behavior problems, we might be missing some disorders. And then 1 in 5 children with behavior problems also had depression. So according to some research that was done in 2010, 1 out of 10 children between the ages of 8 and 15 had an emotional disorder that did have a major impact on daily functioning. So about 10%. So if you'll remember kind of the criteria that we looked at before, or things to consider, is that impact on life functioning. So we're seeing that 10% of kiddos in this age group had something going on that did impact their life functioning. 1 out of 4 adolescents meet the criteria for some sort of mental disorder. I've already mentioned that students at risk for these internalizing disorders fly under the radar. They're sometimes referred to as secret illnesses because there's no outward manifestation of them. We also know that students who are the victims of bullying and who lack adequate peer supports are vulnerable to mood and anxiety disorders. So an example of a mood disorder is depression. And depressive disorders are the most prevalent disorders among adolescent suicide victims. So, so the significance of getting supports for these kids is really a matter of life and death. So here's just some another data chart on rates of depression, anxiety, and behavior disorders by age. So we can see, if we look at anxiety, we've got, somewhere between probably about 11% of kiddos between 12 and 17 had an anxiety disorder. I should mention this is pre-pandemic data. We know that mental illness and problem behaviors have significantly increased with the pandemic. But what I also think is interesting for us to see is that, we've got younger kiddos here too that are struggling with these types of internalizing behavior problems. So here's some data from April of 2020. So the Child Mind Institute did surveys about mental health and mental illness. And at this point, so the pandemic had just started, they noted that about 70% of both children and adults reported mental discomfort. However, the other thing that they noticed was 55% of children felt more sad, depressed, or unhappy versus 25% of adults. And I'm sure that if you are in schools right now, you are probably seeing this. So I don't even need to show you the data. Okay, so let's get into some strategies for helping kids with internalizing problems. I'm going to start with school-wide. So what we know is that when multi-tiered systems of support, such as PBIS, positive behavior interventions and support, account for internalizing behaviors in their system, that can be a super effective strategy for identifying kids and getting them the help that they need with internalizing program or with their internalizing problems. So part of that should be a universal screening where we're emphasizing prevention, we're identifying risk factors, we're looking at both strengths and needs, so we're not just operating from a deficit model. And what we also know for kiddos with internalizing problems, having a universal screening tool that focuses on these different things is more effective and better at identifying kids with internalizing problems than traditional data systems that are used in a PBIS system. So for example, office discipline referrals are often used in a PBIS system. And what we know is these kids are directing their problems inward. And so these are not the kids who are likely to be sent to the office. So taking a look at ODR data is probably not going to identify who these kiddos are. Also, MTSS systems that also include a mental health screening for those students who might be triggered or red flagged from a universal screening can be very helpful. So this is not a diagnostic assessment because typically in schools we're not making diagnoses of these disorders, but it's a tool that looks for indicators of these disorders that you can provide information to parents so that they can seek outside resources, or you can refer to intervention programs that are in place within your school. So mental health screenings typically need to be administered by school personnel who has training in this area. So your school psychologists, your school counselors, your school social workers. And then also a big recommendation for this would be if you're undertaking mental health screenings, that you have an already established relationship or connection to community health resources, because results of a mental health screening might be that a child needs more support than what the school is able to offer. So again, fitting identification and intervention for internalizing problems into our tiered system of delivery. So, wanting to have those universal preventions like a social emotional learning curriculum. I mentioned you might do a mental health screening for those who are referred for selective services. But then, taking a look at what are some evidence-based practices or interventions that your school could use for kids who are referred to a selected or indicated level. And if you have a 4-level system, typically those kids would be being referred probably for special education evaluation or referral to an outside service. So I mentioned at tier 1, we want to have that strong basis of social emotional learning. And so we know that our kids with internalizing behaviors are more targeted for bullying. And so part of that tier 1 support should be some sort of anti-bullying policy practice. You might even have an anti-bullying program that you use. So something that we are addressing, that social emotional learning for all students, for all learners. And then at tiers 2 and 3, again, this is system-wide. We want to take a look at evidence-based interventions. We want to look at strengths as well as skills. If we're choosing an evidence-based intervention, we want to make sure that we can measure outcomes. We want to make sure that it fits in with what our school strategies and visions are. Again, we want to look at the developmental appropriateness, and the culturally and linguistically appropriateness of any evidence-based intervention that we're looking at. Going back to that circle of the family, the student, and the school, interventions, behavior interventions that involve families and or outside supports would be super beneficial. And we also want the skills that the child is learning, we want them to be able to generalize those skills to real world settings. So one of the things that we know when we're intervening on behavior and social skills is that it can be hard to get those skills generalized into regular settings. And so we want to look for programs that allow for that and have evidence of that. So here's just some examples of evidence-based interventions for internalizing behaviors. These are, I think they're all interventions that would need to be purchased, but they are great for addressing internalizing behavior problems. So things that we want to target when we're doing interventions. And some of this is that, and this can be taken system-wide, but it can also be applied on a classroom level as well. So psychoeducation. So we want to make sure that as educators, we're learning about different types of behavior problems and different types of disorders that may present themselves in our school. We also want to target problem solving. Some students are good candidates for self-monitoring, and that can be true for students with internalizing behaviors. I mentioned those cognitive distortions and that distorted cycle that happens. So we want to engage in something called cognitive restructuring, where we are teaching new cognitive thought patterns to undo those counterproductive thought patterns that happen with when individuals have internalizing programs. We also want to do some relaxation exposure. So, you know, for kids who are anxious or just depressed, we can provide strategies on relaxation and social skills, because often these kiddos have poor social skills. So classroom strategies. So it's great if you have a system that supports, like I said, the internalizing behavior, or at least keeps that in the realm of possibility for these kiddos. But there's things that can be done in the classroom as well. So we want to create structured, predictable, nurturing environments. So remember, you know, our kiddos who have internalizing problems, it can be a combination of environmental or genetic predispositions to this type of temperament, or to mental illnesses that fit these behavior patterns. So, you know, things like depression and anxiety run in families. The external things would be things like trauma, whether it's acute or chronic. So one of the best ways that we can address that is through classroom management procedures. So we want to explicitly teach our classroom procedures and behavioral expectations. Again, hopefully this is part of a tiered system. So what we're doing in the classroom matches what's happening in the school-wide expectations. Focusing on those positive student to teacher interactions, providing engaging instruction. We want to make sure that we are actively supervising students. And we'll talk more about that in just a little bit. We want to give high rates of social attention. So remember, these kiddos often don't engage socially. So we want to give them positive social attention, and we want to give them specific praise. So more positive than negative, and specific praise about desired behaviors. So, you know, maybe you have a student who's withdrawn and won't come to circle time. Even if they're making an approximation towards coming to circle time, like maybe when they started, they were just sitting at their desk with the back towards the circle. And maybe now they are facing the circle. We want to give specific praise about that. So we call that they're making successful approximations towards what we want them to eventually do. We also might need to model some very specific things. So there's a concept called adaptive thinking, which is something that most of us engage in, and we aren't even aware that we do it. Well, kids who have internalizing problems often don't engage in adaptive thinking. So for us, like I said, there's an automaticity with it. So let's say that I am working on an assignment and I turn it in and I get it back, and I've made a couple, let's say it's a math worksheet, and I've made a couple really silly mistakes. Maybe I didn't pay attention to the operation sign. So my adaptive thinking is, oh gosh, I missed 3 problems because I thought they were plus signs and they were minus signs, or I thought they were minus and they were multiplication. So the next time I'm going to really make sure that I pay attention to those. That's an example of adaptive thinking. I'm taking what's going on, what is my reality, and I'm adapting my thinking so that I do better next time. So we might have to verbalize our adaptive thinking to model for these students what that looks like. And so really kind of paying attention to what we engage in with our adaptive thinking. And then, like I said, making that verbal. The self-praise. So, we can do that for ourselves. Like, I feel really proud of myself because, and going ahead and sharing that with kids. And then transferring that language to, Jimmy, you must feel really proud of yourself. To give them that cue that that's a time that he or she should feel proud of themselves. We might have to model conflict resolution. And again, this is very explicit. We might engage in this and not even verbalize or think about the steps. But when we are working with kiddos that are having some of these problem behaviors, we want to engage in that very explicitly. Same with problem solving. Same with personal advocacy. So, maybe talking about a time when you stood up for yourself, or pointing out when you see kids doing that in an appropriate way in your classroom. And then finally, social skills, where we're modeling, appropriate social skills, and we're praising kids for it. So, we're showing good social skills, we're observing when kids are exhibiting good social skills, and we're commenting on that. So both the individual kids can hear it, as well as the class can hear it. And then getting into a little bit more explicit instruction, where instead of just verbalizing adaptive thinking skills, actually sitting down with a student or with a group of students to go through adaptive thinking skills. What were you thinking? What are you thinking? How might you change that for next time? And so, giving explicit instruction in that. Mood monitoring is another thing. So oftentimes kids with internalizing problems have dysregulated mood. And so using a how I feel today chart, maybe you check in during circle time with kids about how they're feeling, and really bringing them in touch with how they're feeling, because sometimes these become such a pattern of behavior and such the norm that kids don't even recognize how they're feeling anymore. And then providing an opportunity for mastery of experiences. So thinking about if there's a certain math skill that kids need to become proficient in, what are different ways that they can demonstrate that mastery to you? And the same can be for social skills, for organizational skills. And so again, really focusing on that explicit instruction of those skills. So this is just another list that kind of captures some of the things that I've talked about in a little bit greater detail. So those classroom expectations. So we know, if you're familiar at all with the PBIS system, we want to have a few rules and behaviors that are aligned to whatever our school-wide expectations are. We want to post those rules in the classroom. We want to revisit those rules. We want to teach those rules explicitly for kiddos. And we want to recognize when kids follow those rules. Classroom procedures and routines. So having predictability is really helpful. It's a really helpful strategy for kids who have internalizing problems, because they know what's going to come next, and they don't have to be anxious or nervous or fearful of it. So if there are routines or things that happen in your classroom often, say how they hand in their homework, to teach what that procedure is, and just develop those explicit steps for it. Common classroom procedures, post them around the classroom, teaching those procedures. How do we line up to go to lunch, practicing it, and again, reinforcing when kids do it the right way. Encouraging the expected behavior. So again, this goes to giving that very specific positive verbal feedback. We want to aim for 4 positive comments to every 1 negative comment. And a lot of this is just good classroom management anyway, that benefits all kiddos. And so that would be one of those that would be helpful for all kids. We want to also give nonverbal acknowledgement. So the verbal praise as well as nonverbal acknowledgement. And again, that should be kind of a 4-to-1 thing, where we're noticing 4 positive to every 1 corrective feedback. So discouraging inappropriate behavior. So we don't want to be punitive. We don't want to be embarrassing to kids. We want to take an instructional approach. So if somebody isn't doing something the way that we need them to do it, we're going to maybe assume that they don't know how. And so we're going to instruct them again on how to do it. So we're going to do that without emotion. We're going to be professional. We're going to be kind. And instead of telling a student what they did wrong, we're going to tell them what we want them to do. So the expectations for what they want to do. And if we need to redirect, if we need to reteach, we will do those things as well. When we're dealing with kids who have internalizing problems, it's best to have corrective conversations in private, because they have that, they can have perfectionism and that social pressure. Providing active supervision. So continually monitoring the classroom. Again, good classroom management strategies. So not just during instruction, but during partner work or individual work or group work. Thinking about how you're designing the layout of your classroom so that you can flow and walk around and give active feedback to students, using old school techniques like proximity and nonverbal reminders. Thinking about groupings, you may have to strategically place kids who are struggling with internalizing problems with maybe some strong peer leaders. Opportunities to respond, that is, just making sure that there's different ways that students can respond and show you what they've learned. And so we want to increase engagement time. You might use popsicle sticks to call on kids. You might do choral responding, nonverbal responses, thumbs up. You might have, access to technology. Activity sequencing and choice. So when possible, you give your students a choice for how they're going to sequence through a lesson, as well as how they're going to complete tasks for the lesson. So that could also be kind of the format for the work. So can students work alone? Do they have to work in partners? Can they work in small group? Can you provide different places in the classroom for people to work? And again, different ways that students can demonstrate their knowledge. And then finally, task difficulty. So being aware especially with our kids with internalizing behaviors, we want to set them up for success. And so we want to make sure that we have classroom materials or content that is appropriate for their learning level, and designing a variety of lessons and assignments to meet the needs of the various learners in the classroom. All right, let's go this way. Another thing we want to do is planning ahead for activities. If we know a student, has some anxiety, giving them the schedule, like I said, predictability can be important. Rehearsing the expectations, acknowledging, praising compliance, and showing empathy and acceptance, and really building relationships with these kiddos as well as all kiddos. These are just a couple things. If you have a student who's actively having some issues, meltdowns, or that sort of thing that are involving internalizing problems, asking yourself the question, and I would say really asking yourself this question, regardless of what kind of behavior problem you're seeing: could this be the result of some underlying issue that has gone unrecognized? So whether we're talking about the potential of a disorder or exposure to trauma, just taking a minute to going back to that very first slide about behaviors communication. So what is this communication telling you, and what might be the underlying cause for this type of communication? It's best to be proactive, so providing the student some ways to de-stress before becoming overwhelmed. So providing fidgets, deep breathing, mental imagery, take a break cards, a quiet place in the classroom, that sort of thing, any other sensory toys, and then removing that uncertainty for the student. So making sure that he or she knows the routine and what comes next. So in summary, internalizing behavior problems are a growing area of concern. And so even prior to the pandemic, we were seeing an increase in internalizing behavior problems, as well as disorders that involve internalizing behaviors. And, I think we've learned since COVID-19, this is just continuing to grow. We also have to remember that many of these children are overlooked because they are not exhibiting what we would call problem behaviors. They're not disruptive. They're flying under the radar. The good thing is that students, both internalizing both those who exhibit internalizing as well as externalizing behaviors, can learn new skills. And the skills that they're learning are about coping with the stressors, so things like I said, like trauma, as well as the biological predisposition to some of these issues. Also, teachers and educators can be a valuable resource in supporting the needs of children with internalizing disorders. Teachers have second to families, have the most access to kiddos and see what's going on with kiddos. And then schools can create systems and environments that support student resiliency. And this is true, again, for both externalizing and internalizing problems. Most of our systems that are in place automatically include externalizing problems. And I would just encourage school systems to include internalizing problems. So a few resources, information, checklists, that sort of thing. Access if you'd like to find more information. And some of the references that I used today. And as always, if you have any questions, comments, or concerns, or would like further information, please feel free to contact any of us at the PFS CARE team. Thank you.